Germ theory, the idea that a pathogen infects a person and causes disease. It dates back to the 1700s, but they didn't have a way to actually test for these disease-causing agents until Robert Koch and Louis Pasteur developed their bacterial culture methods in the mid-1800s. It would still be a couple decades before viruses were identified. So any death certificate prior to 1900 that notes a term we know as an infection today either meant the symptoms or was something else entirely. Today, croup is the name of an upper respiratory infection caused by parainfluenza virus. It causes a seal-like bark, particularly in children. There's several videos here on YouTube by doctors in the UK that include audio files from their pediatric patients. They've gotten consent to share, and you can hear what it sounds like. Before the identification of the viral infection, croup meant a swollen or blocked throat, which caused the barking cough. It could have been a respiratory infection, could have been croup, but it also could have been allergies or any other cause of swelling in the throat. Asthma even got caught up in croup. Whooping cough is another respiratory infection with a distinctive cough. This one is a whoop, given the name. Again, there's audio files out there, and in fact, the Wikipedia page for whooping cough or phthisis has a good audio file. If you're interested in hearing what it sounds like, it's also known as phthisis because it was found to be caused by the bacterium Bordetella pertussis. The name was kept once the pathogen was identified because its symptoms are so distinctive. Diphtheria is caused by a bacterial toxin with a name I can't pronounce, but the symptoms aren't very distinctive. And those causes of death before the identification of this pathogen could have been diphtheria caused by the toxin, or they could have been croup, a viral infection. They also could have been scarlet fever, which is caused by an untreated group B strep infection, strep throat. Given how common lung infections are and the varying causative agents with similar symptoms, think about how often we confuse a cold and the flu and pneumonia and COVID these days. A lot of various diseases were probably misidentified or lumped together. But it was a respiratory disease, some of these terms. Another clear example of this is lung fever. This is not a term you'll hear today. It was never really a real thing. It meant pneumonia. It referred to any lower respiratory infection that was accompanied by a fever. It could have been a COPD flare, bacterial pneumonia, inhaled fungal spores, a viral pneumonia, tuberculosis. Another term used for respiratory infections, especially if there was rib pain, was pleurisy. This eventually ended up meaning the pleuritis of today, which is inflammation of the lining of the lungs and the chest wall, chest cavity. But at the time, it could have been any pneumonia with sore rib muscles from coughing. The umbrella term for diarrheal disease is dysentery. It's still the umbrella term, and it was used the same way then as it is now. Bacterial parasitic infection of the bowels, but it doesn't pinpoint a causative agent. It hasn't been completely pulled apart like some of the lung infections. E. coli, Shigella, Campylobacter, Entomoeba histolytica. The commonality is that they contaminate food and water. They all cause dysentery. We don't designate them as specific diseases. They're just infected with, causing dysentery. If you had dysentery with fever, it was pyrexy. But from the 1960s, pyrexia was used to mean a high fever, and that's what people understand pyrexy or pyrexia to mean today, but at the time it was with gastrointestinal. Dysentery with rash was typhoid fever. However, we know today that typhoid is caused by the bacterium Salmonella typhi, which is now known as a subspecies of Salmonella enterica. Typhi is a very specific serovar of the species. So again, terms came into use to differentiate variations of a disease, and they end up being completely different in specific infections once you look at the disease closer up and what's causing it. So how about the nice ambiguous term inflammatory disease? That's something we know today, right? So inflammation was and is a clear symptom of infection. Swelling, redness, heat, pain. Though we also know today that there are non-infectious mechanisms. But inflammation was considered a disease on its own because they didn't know it was caused by anything. They thought it was the disease. So this is listed as a cause of death. It could have been just about anything. Infected injury, skin cancer, allergic reaction. Along these lines, another comment on Substack asked about phlebitis. This is actually a term still used today. It's inflammation of the veins, same as it was first described in the 1700s. Thrombophlebitis is inflammation of the veins caused by a blood clot. And at the time, blood clots could very well have been the cause of the phlebitis. But the defining symptoms when the term was coined was bright swaths of swelling and inflammation on the extremities. So it could have been, like I said, very much could have been actual thrombophlebitis. But it could have been an allergic reaction, skin infection, viral disease, anything that caused inflammation on the legs. Another term from the Substack discussion was brain congestion, which isn't a term used today but came to be known as a stroke, which is when blood flow is blocked to the brain either because of a clot or a bleed. And then those are the two types, the main types. They didn't know about that mechanism, so when they used that term, it could have been meningitis or sepsis. It could have been an aneurysm. The symptoms were much like dropsy of the brain, and so those terms kind of overlapped. If they said brain apoplexy was the general term for a sudden seizure without fever or inflammation or known illness. Epilepsy was known at the time, and the term actually has translations going back to ancient Greece. This is a really well recognized condition. So if someone had a history of apoplexy, they wouldn't have had that listed as their cause of death. They would have had epilepsy or epileptic fit. However, even today, epilepsy as a cause of death is underreported. So it's always possible that apoplexy referred to sudden unexpected death in epilepsy and not a sudden seizure. So you can look through the historical records of your ancestor to determine if this was sudden or not. Along these lines, chorea indicated a neuromuscular disorder. Jerky movements, loss of coordination, convulsions, they're all symptoms considered under this umbrella. The term is still used today to describe the most striking feature of neurological conditions like Huntington's disease. In the earlier uses, it could have also captured some mild forms of tetanus or epilepsy. But again, the diagnosis after death was based on symptoms, so mild forms that don't present as the doctor expects could have been given a different name. So you want to take a grouping look when you're trying to say, yeah, my ancestor died of this because it's listed on their death certificate. A little bit broader definition of cause of death than what's pinpointed on the death certificate. The last one I want to talk about today is rheumatism. It traditionally meant pained joints, which isn't fatal, but if it's listed on a death certificate, it's a malaise or all over muscle aches and pains. At the time, it was likely a viral infection or sepsis. Rheumatic fever is a complication of scarlet fever that occurs when strep throat goes untreated. And that can cause rheumatic heart disease, which is when the inflammation from that infection and fever destroys the heart valves. This is not the rheumatic disease we know today. Rheumatic disease that's treated by rheumatologists is an autoimmune disorder. With as little as what was known about pathogens in the 1800s, they couldn't fathom that the body would attack itself. Autoantibodies was a landmark discovery in the 1940s. So anything with rheumatism, forget everything you know about that term today. They were just sick. All body sickness. Consumption was very sort of similar. Please leave a comment with your questions or causes of deaths in the vital records you're curious about. I love talking about this, and I'll keep an eye. I don't always get all the notifications for comments, but I will definitely keep an eye on the ones for this video so I can answer any of yours. And be sure to subscribe to Gentales either here or on Substack so you can get more content.